are some myths about trauma recovery that might cause harm?
Well, that talking about it always makes it worse, right? Now, I believe that talking about it will not make it worse if you know what to do when you are distressed. And that's why I focus on the skills and building
Mhm.
safety first and then getting into like talking about it and stuff. But most of my clients, once you know what to do with yourself when you get like that, talking about it actually oftentimes from what they tell me feels like a relief.
Absolutely.
Yeah.
Welcome, everyone. Thank you so much for joining us today. We are here at True You Always, and we are with Kaydianne. She is one of our amazing therapists, and I'm very excited today because I get to learn a little bit more about Kaydianne, and I get to introduce Kaydianne to everyone that's joining us today. So thank you so much for taking the time to be here with us. So would you mind sharing a little bit about yourself? What are your credentials and what does that allow you to do?
All right. So I am a licensed mental health counselor in the states of Florida, Massachusetts, South Carolina, New Hampshire, and most recently, Connecticut. I'm also a qualified supervisor in Florida. So what that allows me to do is to provide mental health counseling, right, in any of those states and specifically in Florida as well. I can supervise anyone who is newly graduated and coming into the field and needs to have a supervisor who will basically teach them the ropes of what to do, what not to do, while they work their way towards becoming licensed. Right now, I've been a therapist. I've been a clinician for over a decade now. It's a long time. Every time I think about it, I'm like, whoa,
Time flies.
right? I graduated from Nova Southeastern University. Yeah, with my master's of science in mental health counseling. Yeah, and I've been at it ever since. Right after graduation, I've worked in community mental health, substance abuse rehabilitation, mental health rehabilitation, collaborative care setting, which is focused on referrals from the primary care setting, like primary care doctor, OBGYNs, doctors, that kind of setting. But yeah, I'm pretty well rounded. It's just about some of everything. So,
You have a lot of experience there. That's
yes.
amazing. Do you have any certifications or trainings that you use in your clinical work today?
Oh, yeah, I forgot all about that.
I know
Um,
you do.
right? I am a certified clinical trauma professional too, which means that I have gone through a series of trainings to be able to help anyone struggling with trauma because I've trained on approaches that are proven to be effective for treating trauma and PTSD. So it means that I've gone through like hours and hours of training to get
Yeah,
myself the necessary skills to be able to provide the best help.
that's amazing. And that is something that is very needed. So
Mhm.
that's your clients must be very grateful for that experience.
Yeah, I'm grateful for it. I think it makes us better when we can do the additional trainings to
Mhm.
get better at what we do. Like, because there's
Yeah,
things are evolving all the time, and we have to, kind of be up with the times to provide the best care.
absolutely. Yeah, for sure. Well, when someone starts working with you, what feels different than they might expect from therapy?
Okay, so some people come in, their experience with therapy might have been a little bit different. Some therapist approach is a little bit more non-directional. I am actually quite directional. So I will help you figure out exactly what you need to do based on what you're saying you want to accomplish, where you feel like you're trying to be. Like I am going to get you there, right? But I do actually give feedback. I do actually tell you the truth. Sometimes even when it's hard, I'm going to say it as best as I can, and I'm going to make sure that I offer you the truth with as much care as possible. But I'm going to be honest with you because if I'm not honest with you, I'm not helping you change and get to where you really want to be. So,
And that's important.
yes.
What do you think surprises your clients most about your style?
Well, number one, that again, I am directional, and my focus really is us doing things together. I don't believe that you have to now as my client figure out things after we're finished talking about what you're going to do. I feel like part of my role is to help you identify what those things are so you know exactly what to do and you don't feel like you're floundering or you're lost or like, well, I just met this lady for about an hour. I got this rest of the week to deal with whatever I've got going on and I don't know what to do. So I make sure I'm very helpful in that area and helping you build up like the skills you need to be able to handle life in the moment and then tackle some of like the bigger issues that we might have going on. So
Yeah, that's important when we leave our therapy session and go back into reality.
mhm.
Absolutely. Well, let's talk a little bit about your ideal client fit. So, who are you most effectively able to help? Is there a particular age or emotional pattern?
Okay, so I was thinking about that, like if there's a particular age range, but not really. Like I feel like for me, like I do prefer working with adults. So all of my
Okay.
clients are adults, so 18 and up, but I really can't say there's like a specific age range that works best for me. Like I kind of fit with everyone, from the young adults to those who are middle aged to those who are considered elderly. Like I really do fit well with anyone. But for those who are really struggling with taking care of themselves while also having to take into account the needs of others that they care for. Those are the kind of people that I am most helpful with. Anyone who's experiencing emotional distress, as far as like depression or even mood swings, those kind of clients are a good fit for me. Those with the strongest fit, again, are struggling with taking care of themselves.
Okay. And are there any other specialty areas that you have?
Well, yeah. So I do work mainly with healthcare professionals, those in the helping
Okay.
profession, because burnout is real, imposter syndrome is real, and we need to take care of ourselves so that we
Yeah.
can help others. If we are not okay, we cannot help others be okay as well as we would like to. So that's one specialty of mine. I also specialize in trauma, hence why I have the clinical trauma professional like certification and everything. That's definitely I love working with my trauma, my PTSD clients. Yes, and I love working with my community, my BIPOC, Black Indigenous people of color community. So I also address intergenerational trauma there, racism there as well, race related issues, identity issues. So yeah,
Oh, that's amazing. That's quite a list of specialty areas.
I know.
I love
I
it.
have a lot of things that I love.
I can tell. I can definitely sense your passion. I love that. So, let's talk a little bit about your clinical approach, if that's okay. So, what is your clinical orientation and how does it show up in your sessions?
Okay, well, I would say like my main approach, like for a lot of therapists, would be CBT, which is cognitive behavioral therapy, focusing on how your thoughts, your actions, your feelings intertwine, and then how making any changes in any of those areas can bring about the major change that the client wants. But I also draw from a lot of other therapy approaches as well to make sure that I'm giving a well-rounded skills and I'm providing what the client needs. Like, because if CBT doesn't have it all, then I'm going to go somewhere else that has more of what is needed, and I'm going to make sure that I provide that to my client. Right. So I
Absolutely.
make sure I do that. I'm not very structured in how I do therapy as far as like, I don't use the approaches in a manualized fashion. Right? Because I try to focus more so on applying things as realistically as possible. And the manualized approach just doesn't work well for me and my personality. So I try to make sure that I'm doing things in such a way that it is as authentic as I can be so that I'm providing as much help as I personally being the person who I am can provide.
And that is absolutely such an important factor to consider. And would you say that there's maybe a certain part when you're working with a client where you decide whether or not you want to continue challenging them or okay, it's time to take a pause? Because I heard you say you're not very structured. So how do you determine
Mhm.
that?
Okay, well, again, my main focus, main objective is always to get my client to where they would like to be, like to have that kind of life that they would like to have, help them work towards achieving that. So if that requires me to challenge, I'm going to challenge. If I see that I'm pushing you too hard and you're looking at me like, lady, if you don't leave me alone, I will back off. I will pause. I do work at my client's pace. So I always let them know, like, if I'm pushing too hard, or if I'm not going hard enough or not addressing something you would like, say it to me. I can easily pivot and shift focus to what's more important to you at that time. So I feel like this is a very collaborative relationship. So if your needs are not being met, let me know. I can definitely take care of that.
Well, it sounds like you build a really great rapport with your clients where they feel safe and comfortable to have those conversations. And sometimes those conversations can be tough regarding treatment. So that's awesome that they feel safe to be able to share with you how they're feeling and how they feel like they're progressing in sessions with you.
I
Well,
definitely ask those questions. I feel like it's important because sometimes people won't tell you right off the bat. And I'm like, it's really important that you and I are a good fit and we work together collaboratively because if we don't, you're not going to do well. And that's not what I want for my client.
absolutely. Absolutely. Well, let's switch gears just a little bit. So let's talk a little bit about True You Always and why did you choose to work at this practice?
Well, I chose True You. Honestly, I really, really loved the way that Amber showed up when I had my first interactions with her. She's very genuine, very authentic. And that's what the practice represents to me, authenticity. And that is something that I'm very, very passionate about. It's very important to me that I am able to be myself as well as be professional and provide the care that my clients need. So that is really what drew me to True You.
That's amazing. And for those that don't know Amber, she is our amazing owner and visionary of True You Always. Awesome. All right. So, something that looks like progress but isn't.
Okay. When you're not faced with like any of the problems that you would normally have, like they're like on hiatus. They're not present in the moment. So you feel like I'm great, things are great, there's no problem. And I'm like, well, the boss just went away for a week. I don't what are we gonna do when the boss comes back? So that doesn't necessarily mean that our progress is where we want it to be. It just means we have a period where we're doing great. And that's our time to probably build up our skills so that if there is another issue, we know exactly what to do.
Absolutely. Love that. All right. One underrated skill clients need.
I would say like being able to reframe your thinking so that because sometimes our thinking can be so skewed in such a negative way that it's important to know how to balance that out to something that's not just positive because we don't want to just be positive to be positive, but we want to be realistic as well. And we want to think in a way that is helpful to us, that helps us. So
Absolutely. And a phrase you say often and what you mean by it.
okay, well, I often say progress, not perfection. Rome wasn't built in a day. I say that all the time, meaning your goal is not going to be achieved in a week, 2 weeks,
Right.
3 weeks. That is not realistic.
Mm.
And I'm a very reality based person, right? So everything that we're going to do will start as small as we need to or as large as we need to, depending on what my client's pace is, what's doable for them. And I scale everything based on that. So even if we talk about doing things, you come in and you're like, I ain't do none of it. I'm not looking at you crazy. I'm like, okay, how are we going to work around that? Because it's progress, not perfection. You're not going to get everything right away. And that's okay.
And that is one of my favorite lines. I love that one. All right. When we're in session with you, are you direct or gentle?
Okay, so I'm actually both. Definitely direct, but I make sure that even when I'm direct, I provide my feedback, my input with care because I do actually care and I want you to receive the message. Like I can't just be direct and you're just like, I ain't
Right.
want to hear none of that.
Right.
Right. I want it to be received so that
Right.
it can help you.
Absolutely. Coffee or tea before session?
Okay. Well, I am a tea type of woman and
Okay.
that's the Jamaican in me, it's the island in me. This is drinking tea every day.
One word that your specialty struggles with.
I guess it's like a two word that's like become a one word, but self care. My goodness. Self care. Okay. Being able to draw the line where things require us or make us overextend ourselves beyond what our limits are and knowing how to like stand up for ourselves, speak up for ourselves, express ourselves.
Yeah, so important.
Yeah.
And then I'm going to throw one more at you.
Yeah.
What energizes you about this work?
Honestly, I love being a therapist. Like, I love it. I love just the ability to help someone, like, achieve something that has been hard for them to do, kind of like on their own. That alone energizes me. Just knowing that that is possible and I can be a part of that change for someone really, like, makes me feel like I am doing something important and contributing to, like, not just the person, but also, like, the world, something outside of me.
That's beautifully said. I'm going to leave us with a final thought here, if you're willing. If you could say one thing to someone that might be watching this video today, what would it be?
I would say never give up. Never, ever give up. No matter how hard it gets, no matter how hard it seems, no matter how much things seem like they will not change, nothing ever stays exactly the same forever. It does not. Never, ever give up, no matter what. I am definitely a person that will help push you, encourage you, even when things seem bleak, like there's no way out. I help you be able to deal with your circumstances, even if we can't change what they are, but we can change how they affect you. So never give up.
Well, that is a very empowering statement. For
Thank you.
sure. Thank you so much, Katie Ann, for joining us today. And it was so great to chat with you. And thank you so much for viewing today. True You Always. And Katie Ann is here and she is available. And she's just an amazing clinician. We are so blessed to have her. And her clients are, they just love working with her as well. So I hope everyone has a wonderful day. Stay well. Take care.